Namaste and good afternoon. Welcome to the Freedom from Diseases series presented by Apollo Hospitals, and this is Dr. Srinidhi Chidambaram here. Freedom is the essence of life, proudly and deeply held. We strive for freedom of speech, freedom of thought, freedom of expression, but disease can be an unrelenting captor and can take hold of our lives. Freedom from disease is something that is vital and determines our quality of life and peace of mind. Cancer is one such disease that can cast a shadow on the joy of living, not just for the patient, but for the entire family. But please remember, with ever advancing medical science and knowledge, freedom from cancer is a distinct possibility and reality today. So let us discuss what's new with the cancer treatments. Let us understand the latest technologies, innovations, and path-breaking treatments for humanity to obtain freedom from cancer. Today in particular, we are discussing 3 treatment options, which is Proton Therapy, Tomotherapy, and True Beam. And at the end of the session, I'm sure you know the role of each in cancer care and the benefits. To speak about this fascinating topic, I'm honored and delighted to welcome Dr. P. Vijay Anand Reddy. Dr. Palkonda Vijay Anand Reddy has dedicated himself to cure, care, and crusade to combat cancer. He says, cancer cannot do many things, as it is so limited. It cannot cripple love, it cannot shatter hope, it cannot corrode faith, it cannot silence courage, it cannot invade the soul, it cannot steal eternal life, it cannot conquer the spirit. That really sums up Dr. Vijay Anand Reddy. From being an astute clinician who has embellished the power to heal, he has evolved into a caring and spirited cancer crusader as well. Dr. Reddy is presently the Director and Senior Consultant Oncologist at Apollo Cancer Hospital, Hyderabad, a veteran in this field with academic qualifications from reputed institutes and a medical practice extending over 20 years. Dr. Reddy has handled over 10,000 cancer cases since 1992 with extraordinary outcomes. At the academic pinnacle of oncology in India, he has trained in several reputed cancer institutes across the globe, won several awards, and has been a guest faculty for over 500 CME programs and over 60 publications. His landmark initiative is the Cure Foundation, established in 2003 for selfless activities and dedication to cancer care, which has bettered the lives of so many people through cancer screening and awareness. He's also one of the directors of Sparsh Hospice and actively involved in giving invaluable support to terminally ill cancer patients. The tobacco ban came from the untiring efforts of Dr. Reddy in sensitizing the government of Andhra Pradesh and the Municipal Corporation of Hyderabad. Dr. Reddy, welcome and hello. Thank you so much for joining this Facebook Live. And we're looking forward to hearing from you how freedom from cancer can be obtained through the latest treatments of proton, tomotherapy, and True Beam. Over to you.
Thank you so much, Dr. Srinidhi, for the wonderful, kind introduction of mine. So sweet of you. Right, it's a pleasure to be participating in this. I, in fact, had a club called Freedom from Cancer Club, and where patients who have completely been cured and who are free from cancer have been part of this club. And they also have written their stories, true stories, and they shared their stories, and we have compiled them and bought up a book called I Am a Survivor, which is very much available on Amazon. And this is a true stories of 108 cancer survivors. They shared their journey, how they've gone through the chemotherapy, radiotherapy, and the main parts of the treatment of cancer, and how they've fought the battle successfully and leading a normal life. So that gives a good impetus for the newly diagnosed patients to go through those stories, which are true stories, and they would fight with more vigor, and they would certainly get the inspiration and strength after reading these stories. So pleasure to be in this meeting, and would love to speak on the questions that you would like me to answer.
Doctor, let us begin with talking about overall what are the treatments for cancer, and then we can go on to radiation therapy and then to these specific treatments.
Right. So mainly, if you look at the treatment modalities of cancer, we name them into three main specialties. One is surgery, where the tumor is being taken out by surgeons, and they are called surgical oncology specialty. And then there's called second treatment, whatever we call it as a radiation therapy treatment, where radiation is used to control and cure the cancer. The third modality is medical oncology, where they use all kinds of medicines, medical chemicals, immunotherapy, targeted therapy, all kinds of medication. It could be oral or injectable, and that is used to control or cure cancer. So these are the three main modalities of cancer treatment.
So can you tell us a little more about conventional radiation therapy and what has really changed now? How has it evolved?
Correct. So the conventional radiation therapy has evolved in the recent past, I would say, for the last 1 or 2 decades. There was a tremendous and phenomenal differences between the treatment, which I am part of the witness, where we used to do conventional radiation 20, 25 years, 30 years back, where patients used to literally get a lot of skin reactions, burning of skin, burning of lot of side effects on the lung, heart, and internal organs, stomach, intestines, diarrhea. So the patients are, at least even the doctors used to get scared to refer a patient for radiation treatment. So in those days, radiation treatment was taken as a palliative treatment, not as a main modality of treatment, for the simple reason that the dose that is required to cure a cancer were not able to deliver with the conventional radiation in the past. Now the days have changed, and because completely the radiation is controlled by the computers, and you know how much development that has happened in the computer technology, in the software and the hardwares. So there is ocean of difference between what was done in the past and the present.
So now we can talk about what are the types of current radiation therapy, because we have many options now. So we could talk now about each one of them. First, maybe we begin with the latest one, that is that Apollo Hospitals. Also, we have an entire center dedicated to it in Chennai. So this is about the proton therapy. So what is proton therapy, and how exactly is it administered?
Yeah, so the radiation is an invisible form of treatment, where the patient is actually lying down on a couch, and the machine delivers the radiation beam from a distance, and that enters the patient's body without the patient feel or patient can see those rays entering into his body. This is what you call it as external beam radiation. There is another form of radiation which is called internal radiation, where radioactive sources are placed inside the body of the patient. That is called brachytherapy. So maximum revolutions happened in the way the external beam radiation is delivered to the patients. So this is an invisible form of radiation, where the packets of energy coming out from the machine enters the patient's body. Now, the new development in this is called proton beam radiation. Proton is a particle radiation. If you look at an atom, you all know about the atom. Atom has got the neutron and a proton, which is centered in an atom. It's called a nucleus. Outside the nucleus, you have electrons. So the electrons are used for the normal conventional linear accelerators what we use or across the country, and majority of the centers that we use, we call it as linear accelerators. So linear acceleration of these electrons is called linear acceleration, and the energy coming out of that is called the photon, Photon. So that photon is a commonest form of energy that is used in various institutions across the globe. Now, the proton, which is in the center of the atom, which is taken out with lot of effort, and that proton is used to treat a cancer patient, it's called proton therapy. So that requires a lot of efforts, and it's huge. It costs a lot of infrastructure to direct that photon, which is a particle radiation, and then efficiently increasing its energy and penetration into the deep-seated tumors in the body. So that has phenomenal difference between a photon and a proton. Although the radiobiological effect on the tumor is almost remains the same with photon or proton, but the proton beam has got the greatest advantage over photon by delivering the entire energy in one area where you want to deliver. Whereas the photon therapy, which is the standard linear accelerated treatment, which is there in every institution in the country or in the globe, is it goes through and through the body. That means the energy which is transmitted from the entry to the exit of the body, you have various doses. For example, at the entry it might have 100, but the exit it will have around 20 to 30. That means that the area that it is going through and through, you have the radiation being delivered. Whereas the proton has the greatest advantage of stopping and delivering the entire 100 rads or centigrade or the radiation that you want to deliver right in the area where you want to deliver, and beyond that there is no radiation. That is the greatest advantage of proton beam therapy, and we are really fortunate that is being available in India by Apollo Group, that's in Chennai, and every center in the country, Delhi, Bangalore, Hyderabad, Calcutta, any patient can approach any of these centers and we can coordinate and get the treatment done at Proton Center at Chennai.
So is proton therapy also known to have lesser side effects and safer than traditional radiotherapy?
Obviously, because you are delivering the entire dose of radiation where you want to, and rest of the body will get almost zero radiation. So obviously, that 40, 50, 20% of the radiation which is going through and through with the standard conventional photon beam radiation, that 30-40% dose will cause some kind of side effects to the patient, some kind of immediate side effects, some kind of long-term side effects are known to happen with the photon beam radiation, which are not seen with proton beam radiation.
And what about the kind of cancers which can be treated by radiation and particularly by proton? Are there any particular types of cancers that respond particularly well to proton therapy?
So that's a wonderful question. So if you have an option, because the proton therapy comes with a huge cost, if you have an option of getting the treatment done with cost is not a barrier, then every patient, every cancer can be treated with proton therapy. Wherever there is an indication for radiation treatment, then certainly we can treat with proton. But certainly areas where there is a gross advantage with proton therapy versus photon are the tumors which are deep-seated, tumors which are close to the critical structures, where even the 50-30% of the dose which is given by photon can be reduced to negligible doses. There, proton therapy has got a great advantage. For example, if you are treating a deep-seated skull tumor right in the base of the skull, it has to grow through so many structures all around and hit that particular target, which is possible with proton therapy, which is also possible with photon, but you have so much of other 30 to 70% of radiation into the surrounding structures. So that's the greatest advantage. Even in the chest, in the middle of the chest or in the middle of the abdomen, you have a pancreatic tumor, those kind of tumors, a tumor in the prostate, which is right behind the in front of the rectum and the bladder, urinary bladder. So such kind of complex areas, proton delivers a better dose and very less radiation reactions.
And what about children? Is it that proton therapy is particularly suited for childhood cancers and for children?
Rightly brought by Dr. Srinidhi. As I said, even that 30-40% of the radiation dose in adults may not make much of a difference, but certainly in children, it makes a huge difference. They are growing children, the 30, 40, 50% of the unnecessary radiation into the surrounding structures will have a long-term impact on these children. Will they grow, and there could be a possibility of second cancers in these children. So certainly proton has got a great advantage in treating childhood cancers, brain tumors, craniospinal radiation, Wilms tumor in the abdomen or in the chest, wherever it is. Proton has a great impact, and especially for the eye tumors. When you have a tumor in the eyes, it's very, very significant difference between proton and proton is always preferred over photon in such situations.
We will now go on to the next one, which is the tomotherapy. So could you tell us what is tomotherapy?
Tomotherapy is, I would always say, tomorrow's therapy. So tomotherapy. So it's a wonderful way of delivering radiation, which is not a proton, but it is a photon therapy. It's a linear accelerator. It gives you packets of energy. When a patient is lying down on the couch and the radiation beam is delivering in a circular fashion compared to rest of the technologies, which are, there are plenty of other technologies which deliver radiation, external beam radiation. But Tomo normally is much superior in terms of mainly two important factors that we need to look at. One is that what we call it as conformity index, the dose around the target versus the dose surrounding the structures. If you compare, that is what you call it as therapeutic balance, that as minimum as possible that you should have less dose to the normal structures and as maximum dose possible to the tumor structures. That ratio, if you compare with any other technology, tomotherapy is the best. That means conforming the dose around the target will be the best with tomotherapy. That dosimetry, what we call it as a dosimetry around the target, will be very, very, very conformal with tomotherapy. Number two, which is again very, very important, is when a normal, other than the tomotherapy technology, when a patient is lying down on the couch, the machine rotates around the patient in one angle. Where in tomotherapy, not only that the machine is rotating around the patient, even the patient's couch moves in and out. That means in one rotation, you can treat the entire body in one go. That means whole body radiation is practically very, very easy with tomotherapy. Not only that, a patient has got 5-6 targets in the body. It could be one in the brain, one in the lung, and one in the liver, or one in the bone in the spine. All these 4 targets can be targeted with one single go because the beam is moving around the patient and the couch where the patient is lying down is also moving. So that is the second best advantage of tomotherapy.
So who are the cancer patients who are eligible for tomotherapy, doctor?
So for example, you have a chest wall radiation for breast cancer, craniospinal radiation with one go from the brain. You're treating the entire spine, which is very difficult with the conventional machines, where you need to treat in phased manner with the gaps. Whereas with the tomotherapy in a one single go, entire cranium and spine can be treated. And multiple metastatic sites can be treated with tomotherapy. And because of the highly conformal treatment, that means high dose of radiation in and around the target is very much conformal with tomotherapy, head and neck cancers can be comfortably treated exclusively with tomotherapy.
And what are the safety aspects and what about the side effects in tomotherapy?
As you know that the surrounding structures, the dose is much, much less, and most of the beams are tangential. These tumors, the tomotherapy has very minimal side effects, and probably in some of the patients we see little more skin reactions because the beams are more tangential. Other than that, we don't expect any major complications, or even the minor to moderate complications are very, very less with tomotherapy.
Are there any contraindications that somebody cannot have tomotherapy? Are there,
Absolutely no. Wherever there is an indication that the patient requires radiation, the patient can be put them on tomotherapy.
The other radiation option that we hear a lot about is the True Beam. So could you now tell us a bit about that and also about how it is exactly administered?
Yeah, it's we call it as a really true beam. All the photon energies that is delivered these days, the new technology in the linear accelerators is True Beam, and I'm so fascinated that this technology has come into our country, and we are in possession of that technology. It's an extremely good technology. I would call it as a workforce and a workhorse, where you can treat any tumor from head to toe in a single go in 1.2 minutes with a very high energy beam and with a micro millimeter calibration that we can do a deep-seated tumor. The traditionally radiation is given for 5 to 6 to 8 weeks. With the True Beam, without any immobilization devices, we are able to deliver high dose of radiation and cure cancers which are less than 3 to 4 centimeters in 2 to 3 days. So that kind of a high precision and high dose of radiation with very minimal time in 1 to 2 minutes, we are able to deliver, and in a shorter period. Those days for 6 to 8 weeks are gone to have become 3 weeks or even 1 week or even 1 day that we can deliver high dose of radiation and then control the cancer and cure the cancer.
So we have now discussed 3 different radiation modalities, the proton, the tomotherapy, and the True Beam. So how would you kind of put them all together in perspective? So how should a patient or a person who's been diagnosed with cancer, how should they approach this whole thing? Like, should they, will the doctor decide, or should they get to know more about these things? So what is the comparison, and where do they all stand in relation with each other?
First and foremost thing, I would always suggest a patient to meet a team of doctors, which Apollo has been practicing since its inception, all the cancer institutes, which is called a tumor board, where you will wipe off the bias. You have all the team members, medical oncologists, surgical oncologists, radiation oncologists, as well as the pathologists, rehabilitation, everybody put together, and then counsel a patient what could be the best modality of treatment in that particular patient. I should not say that because I'm a radiation oncologist, radiation is the best. So in that particular scenario, surgery or radiation, or it's an order, but the patient should go for surgery first and then come for radiation and then chemotherapy. So each cancer, each stage would have a pattern of treatment, a standard of treatment, which should be discussed in a group and give the plan of treatment to the patient. So this could be the best way. You start with chemotherapy, reduce the burden, operation, you do surgery, and then do surgery. I'm just giving an example. So that kind of a plan should be evolved by discussion by a group of team of doctors. Then suppose a patient is radiation is indicated in that particular patient, then that should come to the Department of Radiation Oncology. Once he comes to the Radiation Oncology department, again a team of group of doctors would tell him what kind of tumor that he has, what could be the best modality in that particular patient. Of course, finances is one of the important criteria to take up the higher end technology. But these days, most of these higher end technologies are, I think, acceptable and available and can be customized based on the finances and the stage and the requirement of a patient. And certainly, if a patient requires a higher modality of treatment, although his finances are compromised, we are there to help. Apollo has come up in a big way to support the patients who have financial issues, but we never compromise on the quality and the standard of care that is required to that particular patient. So that is very, very, very important. Based on the need, based on the necessity of that patient, we would explain them why this technology is important to that particular patient, why this technology makes a difference compared to the conventional and the standard radiation. If that works out better, if the finances is only criteria, that also will be addressed, and then we would take care of the patients.
Absolutely. So we will now look at some questions that are coming to us on our Facebook feed. I'll just read them out.
Sure.
How long do the proton therapy treatments last?
The treatment traditionally is decided how much dose and how long the treatment need to be given based on the site and type of the tumor that the patient has and the stage of the disease. Whether the patient has already undergone surgery and is coming to take care of the post-operative measure where we are treating the microscopic disease. So there is different from a patient coming with the tumor intact to us. So duration of the treatment depends on the stage, type, and the scenario, that is radical treatment or a post-operative treatment. It varies from 3 days to 6 weeks.
We have discussed this, but this question is again, what is unique about treatment using variance True Beam technology?
Right. As I said, it has got an image guidance, which, when you do a scan of a patient in an outside the treatment room, and then you do the computer planning outside the treatment room, and then the patient comes onto the couch on for the treatment. So whatever is planned outside, whatever scans that are done outside, and your treatment is based on those scans, and the planning is done based on those scans, which have to exactly be simulated when the patient is lying down on the couch. So that kind of image guided radiation treatment is possible with the True Beam. And most of the times when you are doing this, we match the bone elements and then the soft tissue elements and then the tumor elements. So based on that only, then the beam will be on. And when the beam is on, again, if there is any fraction of a moment the patient moves off, then the beam stops. So it has got so much of ingredients and infrastructure within that technology that we are so excited to use that technology. So we feel so comfortable that we are what we want, what we did in the outside the room is exactly happening within the treatment room. So that is the best part. The other issue is that the True Beam has got a very high energy beams. Earlier, it used to take around 5 to 8 to 12 minutes for delivering 200 centigrade. Now, with this high energy beams, we are able to finish the treatment within less than 1 minute, so that the patient will not feel bad, he will not feel claustrophobic when he is in the radiation room.
Post the radiation treatment, when will the side effects subside?
Yes, so the intensity of effects, whatever the side effects that happen in the area where it is being treated, it is bound to happen because we are treating an oral cavity and we are treating that area. Certainly that area would be having some reactions, and those reactions would continue to be there for at least 2 weeks. And after 2 weeks, slowly within a week to 10 days, all those reactions will settle down.
What are the side effects of tomotherapy, and which is better, chemo or radiation?
Chemo, that's a difficult question to answer, and it is not fair on my part to say one modality is better than the other. It purely depends on what kind of cancer that the patient has. That is what I was telling you, that we need to sit in a group and discuss, where surgeons, radiation oncologists, and medical oncologists all sitting together and then discuss, and what is the best modality in that particular patient, in that particular stage of the disease, is decided by a group of doctors. There are some areas where you can say surgery could be better or radiation could be better, or both are equally good. In that scenario, we would put it across to the patient, and some patients are interested in going for surgery, and some patients say we do not want surgery, we would like to go for radiation. So there is an option. But most often, we have a pretty standard international guidelines for a particular stage of the disease, for a particular type of the disease. This is a way to go, and that is being put to the patient.
Can proton therapy be used with other forms of cancer treatment?
Yes, as I said, if given an option, any part of the body, cancer from any part of the body can be more safely be treated with proton therapy.
Will I lose my hair with tomotherapy?
Yes. So that's the best part of tomotherapy. When you are treating a tumor which is on the scalp, that means the skin covering the brain, the tumor, the skin cancer on the scalp, we can treat without hurting the internal structures, which is the brain, which is very, very difficult for other technology. But if you are having a tumor in the brain and the scalp with the hair is protected with tomotherapy, so that's the beauty part of it. So you can protect your scalp while treating the brain. Similarly, you can protect the brain while treating the scalp. You know what is scalp? Scalp is covering the skin with the hair. That's called scalp. So that's the best part of tomotherapy technology.
Is proton therapy as effective at treating cancer as conventional radiotherapy?
As I said earlier, radiobiological effect on the tumor cell is the same for the proton or photon. The effect of radiation as the proton or photon on the tumor is exactly the same. But the morbidity caused with the radiation treatment short term or long term or very minimal with proton therapy?
I think with that, we have come to the end of the questions. Dr. Vijay Anand Reddy, thank you so much for participating in this session and giving us very clear insights on the various radiotherapy modalities. And I'm sure people who are waiting to hear about these different types of treatments have had all their doubts clarified. Thank you so much. It's been a very inspiring and illuminating discussion. Thank you, viewers, for participating. And from Apollo Hospitals, we say to each person who's been diagnosed with cancer, whatever you do, hold on to hope. The tiniest thread can twist into an unbreakable cord, and let hope anchor you in the possibility that this is not the end of the story, but the beginning. And it is that change of mindset that will bring you to peaceful shores and also give you victory over the disease. We wish you all the very best. Be safe. Take care, and remember that Apollo Hospitals is always with you totally in your journey to conquer cancer. Please subscribe to our YouTube channel to get the latest information on health trends. And also, if you have more questions on this session, please reach out to us on Facebook Messenger or put your comments on the inbox or on the Facebook page itself. So till we meet again, stay safe, stay healthy, and take care. Thank you and namaste.